Now's the time for we the people. Now's the time to wake up this nation. Now's the time for we the people. Now's the time. Our tomorrows will depend on what we do today. Let need not greed lead the way. For every ill there is a pill for which we're overcharged, except for one that brings relief for the hypocrisy at large, from those who protect life religiously from conception to a baby's birth, and then ignore its health, safety, and welfare once it's born upon this earth. Children are being left behind as the Pentagon spends more, while millions have no health care and waste billions waging war. Corporate puppeteers pull the strings and chart the course as puppet politicians sell us out without remorse. Now's the time for we the people. Now's the time to wake up this nation. Now's the time for we the people. Now's the time. Our tomorrows will depend on what we do today. Let need not greed lead the way. Now there are those who truly believe you either have or you are had. Right is wrong and wrong is right, and the common good is bad. They want to privatize and profitize and corporatize our nation and make our government of the people a government of the corporation. Now's the time for we the people. Now's the time to wake up this nation. Now's the time for we the people. Now's the time. Our tomorrows will depend on what we do today. Let need not greed lead the way. Let greed not greed lead the way. Seems welfare is a dirty word when it helps the sick and needy, but rationalized when it's disguised as tax cuts, tax breaks, loopholes, subsidies, buyouts, and bailouts for the rich and corporate greedy, who say they want more freedom, but what they do not say is that they want more freedom to take your rights away.
Before they get madder than they are, let's introduce them right now. Come on up here, the Man Is Hell doctors.
My name is Mike Huntington. I was a cancer doctor for 35 years. I loved helping patients fight their diseases, but what made me most upset were patients with advanced cancers who had delayed seeking or accepting medical attention because they couldn't afford health care. A nurse at our cancer center overheard this conversation between a patient and his wife. Honey, they want me to take chemotherapy and radiation therapy. There's no guarantee that it will work, and I don't want to leave you and the kids homeless because of my medical bills. By the end of 2014, 2/3 of patients who remained uninsured were actually eligible for health insurance subsidies under the Affordable Care Act found they could not afford premiums or were told they didn't qualify. So deferred treatment, avoidable suffering, and medical bankruptcies will continue until we take the next step. You and I must continue to fight for single-payer, universal health care.
Hi, my name is Chris Gosser. I'm a radiologist here in Salem, Oregon. As a radiologist, I have the privilege to see inside people using various modalities. There we go. In order to help diagnose and treat diseases. And when I look inside the American healthcare system, I see a sick patient. I see money meant for healthcare diverted for advertising, like the Moda Center up in Portland. Utilization denial, review departments refusing to approve tests and treatments that doctors have recommended for their patients. Insurance company administration and hospital billing departments, they're huge. Shareholder profits and exorbitant CEO compensation. I see Americans living sicker and shorter lives than people in other countries. I see two people with the same illness. One person gets everything they need, the other person has to go without. Despite the expansion of the Oregon Health Plan and insurance exchanges, I see the Salem Free Clinic celebrating its 10th anniversary and 30,000th patient because there's still a need. I see unnecessary suffering and worrying. I see 1.7 million people living in households experiencing bankruptcy because of medical debt. I also see a cure. It's not Obamacare, it's not coordinated care organizations, and it's not increased competition. It's health care for all Oregon, it's improved Medicare for all, it's Americans looking out for one another, it doesn't interfere with the doctor-patient relationship, it's affordable and moral, and it's something only our government can do. And it wasn't even an option during the creation of the Affordable Care Act. And that's why I'm mad as hell.
Hi everybody, I'm Joe Eusterman. My specialty, occupational and environmental medicine, is about health and safety in the workplace. The truth is that Oregon workers often do not get the care they need for work-related injuries and illnesses because of profit motives. And ethical, competent, dedicated doctors and nurses are being terminated for objecting to profit deciding how they care for workers. Oregon courts have decided, quote, "It is not improper," unquote, for employers and unethical providers to put profit ahead of care. It's a matter of record. Oregon Court of Appeals citation number A120010, page 238. Check it out. Another outrageous injustice health care for all Oregon would correct. State government must be held accountable. No health care justice, no peace. Thank you.
My name is Eugene Uphoff. I'm a family doctor from Portland. Okay, so look, here's the deal. Are you worried about measles? Yes. Do you worry about Ebola? Yes. We should be a lot more worried about the failure of our healthcare system to prevent common needless deaths. The brutal truth is that 1 out of 20 Oregonians risk death in the next year simply because they have no health coverage. 8 Salem residents will die this year because they have treatable conditions that were not insured. 118 people in Portland area, metropolitan area, will die needlessly for lack of health insurance. And 195 Oregonians will die from conditions that, had they been insured, could have been successfully treated. But, you say, doesn't the HCAO fix that? The short answer is no. The longer answer, though, is that the HCAO does extend insurance for some people. The insurance, however, is still too expensive, too wasteful, too restrictive, and it leaves out 5% of our families and neighbors with no coverage at all. So we need to have universal, comprehensive, affordable, publicly financed health care to stop this needless loss of life. Support health care for all Oregon.
Hi, I'm Hank Elder. I'm a psychiatrist in Canby. I too am a mad as hell doctor, and but I also want to emphasize, besides being mad as hell because of the wreckage that we live with, because of our poor, our failing healthcare system, I have a dream that I share with you, that we will put together a way to help comfort, to provide care for everyone, whether they're immigrants, whether they have no resources, whether they're depressed, psychotic, anxious. We'll provide care and comfort for those people. We need to establish a way to do that. And that system is single-payer health care for all. Thank you.
Hello, I'm Frank Erickson, a radiologist from Pendleton, Oregon. Thank you. I have a set of acronyms for you, if you know what those are. The cure for FT is SPEINO. I pronounce it I know. Madisell doctors have been conducting grand rounds on all of us for the last 6 years, gathering information, and we all have agreed on the diagnosis of a disease. The disease is responsible for thousands of deaths that are preventable, disability, bankruptcy, also preventable, and the diagnosis is FT, which stands for financial toxicity. This is a name we gave it from oncologists in New York that finally decided enough was enough and to name names. Financial toxicity has a cure. The cure is proven effective in all other industrialized countries that use SP, single pair, EINO. Everybody in, nobody out. The cure for FT is SP, I know. Thank you.
Nobody out! Everybody in! Nobody out! Everybody in! Nobody out! Everybody in! Nobody out! Everybody in!
I'm Gail McClave. I'm a family physician in Bandon, Oregon. And I had something in mind to say today, but Mike has asked me to tell him a story I told a few years ago about when I was working in the small ER. And in came a man, unconscious. He was sitting at the local diner and just went face down in his soup. And he had had a huge bleed in his head with his pressure of 240 over 120. He was taken up to Portland by Life Flight. He had no insurance. And his family went up there. And for the next 7 years, he was kept in a vegetative state in a Medicaid nursing home, visited by his family whenever they could get up there. He had 5 young children. He had planned for all of them to go to college. None of them went to college. However, they did get health care once their father had had a stroke, because now they were the poor and they could get on the Oregon health plan. So for $4 a month of blood pressure medicine, this man did not need to become a vegetable for 7 years. We need to fix this. We need universal health care now.
Hi, thank you for being here. My name is Robert Seward. I'm a retired internist, and I'm witness to a story that I want to relate to you. After Katrina, doctors and nurses went down there to renew prescriptions, do first aid. This gentleman came in, sat down. He was 55. He had 5 kids. He was a worker, African American man. I said, what can I do for you? He said, I need my blood pressure pills. So I checked his blood pressure. It was 230 over 130. He felt fine. I said, this can't be. So I checked it again. It was 230 over 130. I gave him his 2 medications. I added a 3rd medication because we didn't have ER coverage in New Orleans at that time. 2 days later, he came back. His blood pressure was 130 over 95. The crisis was over. Why? Because he got these 3 little pills. And I learned after that there's a lot of people with hypertension in this country. 42% of black Americans, 30% of white Americans. And the statistics that are really scary is that 20% of those people don't even know they have high blood pressure. They feel okay, but they're not okay. Say that with me. They feel okay, but they're not okay. They're just right. They're going to have a stroke. Now, what we need is a primary care healthcare system where these people can go in and see their doctor or nurse, get their blood pressure checked, and get on medication so they don't have a stroke. That's not okay. It's not okay that all these people are not getting their blood pressure pills here in the state. So what we need is a single-payer healthcare system. Thank you.
Hello, I'm Dr. Janet Bates. I worked for 13 years in Bandon, Oregon, and I now live in British Columbia. I've been a physician in both countries for a considerable period of time, and I also was a patient in both countries. I received chemo and radiation for cancer. Because I had a prior condition, my insurance here was $900 a month, and in Canada it's $50. They both, and then in this country, once I needed treatment, I had to pay the first $10,000. What I wanted to talk about just briefly was some of the myths about the Canadian healthcare system. There's very little differences between finding a doctor. If you are in Canada, you can go to whatever doctor you want to, primary care doctors. You need a referral to specialists and subspecialists, but the only thing that really makes people have to wait longer is a problem that's the same here, is there is a bit of a shortage of certain doctors, and so you might have to search around for a doctor, but that's the same here. So there's nothing in our socialist system that limits who you can see. The other thing is, there is a myth that people have to wait for everything. Well, the truth of the matter is, yes, they do have to wait if you need a total hip replacement or a total knee replacement. But if you need an emergency procedure or something that's going to be affected by how long you're going to have to wait, you don't wait. If you need cancer treatment, you don't have to wait. I just thought I'd point that out. Thank you.
So I'm Paul Hochfeld, I'm an emergency doctor. How many people here think we have a broken healthcare system? No, we don't have a healthcare system. I'm serious. The only thing systematic about it is it's made up of a bunch of economic entities that are trying to profit off of illness. We need a system that everybody's in, with which we can have the goal of having healthy communities instead of profits.
So Peter Yarrow, Peter, Paul, and Mary, when he was in Oregon, he said, "You will be a movement when you sing like a movement." This next is it was an old blues song written by Tampa Red, but I took it and turned it into a healthcare song, which wasn't really that big a step. It's called Things Are Becoming My Way. Ain't got no money, can't buy no grub, backbone and evil, they're doing that old belly rub. But after all, things about coming my way. My sister was sick. Doctor wouldn't come. 'Cause we could not pay him. The proper sum. And after all, my heart traveling. Things about coming my way. Well, I got to thinking, it sure don't seem right. Well, the poor folks must choose between healthcare and life. Got to thinking some more, and it didn't seem fair that all of our people can't get Medicare. When your body is sick, and your cupboard is bare, you don't want insurance. You want real healthcare. got to love it.
Got to speak up loud.
You gotta speak up so loud.
What you can't do alone.
What you can't do alone.
Sure can do in a crowd.
And after all, your heart traveling. Yeah, things about coming your way. And after all, your heart traveling. Things about coming your way. Thank you.
Now is the time to heal our nation. Without health care for all, there is no liberty or justice for all. So we need to heal this nation. And what I'd like you to do is join me in communicating that message to our legislators. And here's what I want you to do. I want you to join with me on this song I'm going to do. And all you have to do is on every chorus, come in right at the beginning of that chorus, because what you're going to say is this with me. Okay? Here's what it is. Health care for all. Do that with me. Health care for all. Now I'd like you to take the health off and just go this, because this is what we need to do in this country. We need to start thinking that we can do this. Care for all. Keep it up. Care for all. Louder. Care for all. 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 Big health insurance and big drug won't kill health care reform, my friends. They're shopping on campaign fast, your family will never. Excuse me just a minute, let's start that again. Excuse me. Whoop. What I'd like you to do is just say that on the chorus time. Okay? Save all your energy to say it as loud as you can on the chorus. And you'll hear the chorus. I hope you hear it out there. It just says, I'll say health, and then you say care for all. Have you got it? Yeah. Let's try that one more time. Here we go. Health care for all, because health care is a right. Health care for all. Time the U.S. saw the light. The best health care plan is a single payer plan. Now's the time to finally put it on the table. Big health insurance went to Congress to ensure its own survival and ensure health care reform arrived there, dead on arrival. They're spreading fear with blatant lies and rhetorical pollution. They obstruct the truth to protect and serve self-saving institutions. Profit before people and greed before goodwill is their battle cry as they move in for the kill. We the people with collateral damage, someone's loved one died today, cause conditions pre-existed or they couldn't afford to pay. Here we go. Health care for all, because health care is the right. Health care for all, time the U.S. saw the light. The best health care plan is a single payer plan. Now's the time to finally put it on the table. Big health insurance went to Congress to ensure its own survival and ensure health care reform arrived there, dead on arrival. They're spreading fear with blatant lies and rhetorical pollution. They obstruct the truth to protect and serve self-serving institutions. There's no other way to say it. We've been lied to and misled, and to another greedy corporate mess, how many thousands must lay dead before we wake up from this nightmare to the dawn of a new day. And putting people before profit will become an American way. Here we go. Health care for all, because health care is right. Health care for all, time the U.S. saw the light. Best health care plan is a single payer plan. Now's the time to finally put it on the table. Now's the time to to finally realize we the people must make some choices. If we want health care for all, now's the time to raise our voices till they hear us in the halls of government and behind each corporate door, that we're sick and tired of getting less and less while paying more and more. But there are those public servants who have forgotten who's serving who, and now's the time we need to let them know our interests are special too. Let them hear us. Health care for all, because health care is a right. Health care for all, and the U.S. all the light. That every woman, child, and man should have health care in this land. Now's the time to finally put it on the table. Now's the time to finally put it on the table.
I want you to give a shout out for all the people who've been working so hard to put this together. Thank you. I want to give you a little idea about who we are and what we've accomplished in the past year. So tell me, how many of you were at the rally last year? And how many newcomers are there this year? All right, we're growing. And I'll give you some numbers to back that up. We are organized in 15 different counties with 21 local organizations and at least 41 legislative districts all over the state. We are now up to 14,000 people in our database. A year ago we had only 8,000. We've gained 6,000 supporters in the past year. We have a total of 6,964 statements of support, which I am going to present to Michael Dembro later. We have over 2,000 photo petitions and 209 faith statements to be presented at the legislature today. So today, we gather at the state capitol in the month of February, the beginning of the legislative session, and also the month in which we honor Black history. Today is 2 months and 3 days of the sesquicentennial, that's 150 years, of the assassination of Abraham Lincoln. He was our first and greatest healer. We stand in the long shadow of many failures of healing to declare that all lives have value. But to preserve that, to make that real, we must have health care for all. I give you the president of our organization, Lee Mercer. He's the former director of the Main Street Alliance of Oregon, an organization representing small business. For the previous 11 years, he did advocacy work with the legislature with Oregon Center for Public Policy and the Second Harvest Food Bank of Santa Cruz County in California. Lee Mercer.
Welcome. Health care for all advocates from all over the state. Welcome. As red-shirted Oregonians from every corner of the state surge through up these steps and through the Capitol halls, we are part of an honorable tradition, a movement of taking steps to improve the health care of Oregon and America. For over 100 years, Americans have sought a comprehensive national health care program, from Teddy Roosevelt to FDR, from Harry Truman to Richard Nixon, and from Teddy Kennedy to Hillary Clinton. Bipartisan efforts have been made to create a perfect universal health care system. 50 years ago this year, Congress took the step of creating Medicare and Medicaid, a means to assure senior citizens and those living in poverty won't go without health care. 118 million Americans, 1 in 3 Americans, benefit from those programs now. In 1993, Dr. John Kitzhaber guided the legislature to pioneer the Oregon Health Plan. Most recently, Oregon legislators increased access through Medicaid expansion and Cover Oregon, and are creating a national model for cutting costs with the coordinated care organizations. But CCOs and the ACA will not eliminate the bloated and inefficient health insurance system. 20% of our health care costs are tied up in admin expenses and supporting tens of thousands of paper pushers. Along with the cost of out-of-control pharmaceutical costs, this means our U.S. system costs twice as much per capita as healthcare in all other industrialized nations. And despite 95% of Oregonians now having healthcare coverage, many still lack access to healthcare. High money premiums, co-pays, and deductibles mean families face excruciating decisions as to whether they can afford to get health care they need. We are here to ask the legislature to take the next step in health care reform, to pass the Health Care for All Oregon Act, a publicly funded system that would cover everyone living and working in Oregon, and to pass HB 2828, a bill to support, to research how we get there. Health care for all Oregon, everybody in, nobody out.
Health care is a human right. As a child, I remember my mother's agony lamenting over the loss of 6 of 16 children during the 1930s and 40s. 6 children who should have survived, but didn't, simply because of minor birth complications, such as being born with the umbilical cord wrapped around their tiny, frail necks. She often shared that if she had sufficient funds for health care or equal access to physicians, her children would have survived. She attributed her losses to inappropriate and denied access to medical services because of expense, racial inequality and inequity, and the public and political acceptance that health care services should be a marketable commodity as opposed to a public good. Had health care been considered as a human right, if health care had been distributed as a public good as opposed to a commodity for profit, no one would have died. They all would have survived. The entire family would have thrived. We would have experienced a life and lifestyle of liberty, justice, and the pursuit of happiness. Unfortunately, we lived in an environment where society accepted and agreed and denied, divided, and limited health care services that were distributed according to racial ethnicity, affordability, and accessibility. If my mother had been allowed equal access to meaningful, affordable, and equitable health care services, she would have not suffered from what we know today to be a health disparity. We are still subject to the ills of inequities and health disparities because the same fragmented healthcare system of services we have long accepted as being accessible, affordable, and timely. I, like my mother, was without health care coverage as recently as January 2013. Only with the enactment of affordable care, I'm now covered. However, I developed an asthma condition that requires, that Oregon does not cover. And imagine, without it, we know what the outcome would be. So, I have to pay out of pocket. I share my story with you today to emphasize that not much has changed in the 21st century. We deserve more, and we must not rest or relax for anything less than wholesome benefits that include comprehensive or holistic health coverage for all. So, legislators, hear us. Hear us shout. Health care is a human right. Everybody in and nobody out. Health care for all Oregon is what we're talking about.
you just don't care for health care, waving from side to side. We're here healing the health care blues, am I right? Yeah. I can't hear you. Is this a rally? Somebody say yeah. Yeah. We're from all parts of the state for a common cause, healing the health care blues. Yeah. Healing the health care blues, that's what we're trying to do. Come on now. Healing the health care blues, it's up to me and you. Everybody in and nobody out, that's what we're trying to do. Everybody in and nobody out, it's what we're trying to do. Everybody in and nobody out, it's up to me and you. Healing the health care blues, that's what we're trying to do. I don't care what party you're in, Democrat or Republican. I don't care what party you're in, independent or nonpartisan. Healing the health care blues, the only way we can win. Y'all repeat after me. This is what we're doing. This is what we're doing. Healing the health care blues. Health care blues. Healing the 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 health care blues. That's what we're trying to do. Health Bill 2828. Come on, let's pass it through. Health Bill 2828. Come on, let's pass it through. Healing the health care blues, it's up to me and you. One more time with feeling. Everybody, you ready? Here we go. Healing the health care blues. 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 That's what we're trying to do. Hands in the air, wave your signs from side to side. Here we go. Healing the health care blues. 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 That's what we're trying to do. We're going to do it one more time with feeling. Here we go. Healing the health care blues. 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 It's up to me and you. Thank you.
problem. That part isn't hard. The second step is everybody realizing they're like you. They're holding the same card. Step 3 is finding there's a tactic when everyone believes it could be true. That if all the people work collectively, there just might be something we can do, and everything can change. So quick. Businessmen and TV sets will try hard to make sure it isn't so. You don't have a problem, and if you do, it's not the same problem. And if it is, well, there's just nowhere you can go. But it's happened many times. The history is rich, though we easily forget how a meme can take hold and grab you, how it can spread out like a net, and everything can change. So quick. Lost, or we're dreaming, or they'll make a dream for us. They'll try to come up with a good story about why we belong at the back of the bus, about why we belong in this position, about how we don't know what we meant, about how there most certainly isn't any such thing as the 99%, but everything can change. So quick. Everything can change. So quick.
My name is Elisa, and I'm a medical student at OHSU. And I speak today not to claim to represent the institutions or clinics of which I'm a part, but only to bring my individual experiences, what I've seen and known to be true, as a future doctor whose actions and inactions will pivot many lives. As a second-generation Filipino-American, I never forget how fortunate I am to stand here and represent my communities. It's not just because I know that women hold up half the sky, yet historically only receive part of the pay and more of the intimate violence. Nor is it just because as a person of color, I've seen more of my community waiting in poverty or prison pipelines rather than scaling Ivy League towers. I feel fortunate because somehow someone entrusted me with the capability to wear this white coat, so that I could do something about the histories that patients entrust in me. Yes. Like when I worked on a clinical study on kidney disease, and a participant shared with me that her free study visits were the only way to afford getting regular medical attention after an expensive ER visit for a heart attack put her in extreme medical debt. Or when a middle-aged man who had gone through repeated bouts of unemployment ignored seeking care for the tingling and loss of sensation in his feet, and his first visit to my free clinic revealed unmanaged diabetes that would likely need amputation of his toes. Or when a 40-something-year-old mother had been diagnosed with HPV but never had follow-ups for 7 years to check on cervical cancer because she did not know how to get affordable care as an undocumented immigrant. My clinic teams responded to these patients with referrals, creative but inadequate treatments, expensive procedures, and re-referrals, only to get so far. And we were tired. We are tired. Our patients are tired. Yes! I have gotten sick of doing and fixing behind the scenes, gotten scared that I may graduate into a landscape where my time won't be spent taking care of human beings, but navigating obscure bills. And it is time to step up and be heard for all the patients and communities that I represent. We've already seen how our policies have created hurdles where race, gender, disability, mental illness, and poverty biases intersect, but now we stand in a dynamic moment where our policies are shaken and can be retooled. Let's finally remove these structures and barriers to health. healthcare for all.
My song to the people of the world. It all begins with one. Here we go. The power of one. Joining the hundreds of millions of people believing in one. The power of one. Don't hang around. Stand up or sit down and believe we can change the world. Together we can change the world. Please don't close your eyes. Please don't turn away. Let your voices rise. Put love on display and change the world. Together, change the world. Here we go. Oh, 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 what if it all depended on me to change the world? Change the world. What if my only responsibility was to change the world? To change the world, let me be the one to start a revolution. Let me sing my song to the people of the world. It all begins with one, the power of one, joining the hundreds of millions of people believing in one, the power of one. Don't hang around, stand up or sit down and believe we can change the world. Together we can change the world. Together. What kind of love can conquer disease and change the world? Change the world. What can I do to make poverty history and change the world? Change the world and me the one to start a revolution. Let me say, you and me can make it. You and me can make it. You and me can make it better together. You and me can make it. You and me can make it. You and me can make it better together. Let me hear you. You and me can make it. You and me can make it. You and me can make it better together. You and me can make it. You and me can make it. You and me can make it better together. You and me can make it. You and me can make it. You and me can make it better together with the power of one.